Well, good afternoon. I'm the Shadow Minister for Health, Mental Health and Ambulance Services, Mark Bailey, and I thank the Queensland Nurses and Midwives Union for the invitation to address you today. Can I acknowledge the traditional owners on the land in which we gather, the Yagara people here in Annerley, where we're based here at the studio, and offer my respects to elders past, present and emerging for a culture that goes back more than 60,000 years on the land in which we gather. Can I acknowledge your Secretary, Sarah Beeman, all the members of your executive, all of the delegates for your hard work. It is really important that the representation of nurses and midwives is a collective action, and I know it takes up a lot of commitment and a lot of time outside of work hours, but it is an essential thing to ensure that we've got the best health system that we can possibly have. So I want to thank all of you who work together and advocate for your workmates, who organise your workmates, and get the message across about what you need, because you are a fundamental part of the Queensland health system, and what you're doing is a really important thing. And I want to acknowledge that first up. And I see that, I went to Prince Charles Hospital on Monday to see a friend, and I could see the EB12 posters and all around the facility. I know that people are out there, and that will make a difference, I think, to the outcome. I've got no doubt about that whatsoever. So thank you for all of your activism and your passion about your workplace in every way. Can I acknowledge also your work 24/7, not just last year and the year to come, but over the last 5 years. It's been a very challenging time, and in particular for your profession. So thank you for all that you've done at one of the most difficult periods for your profession in a very, very long time. What we've seen with the EB12 process has been regrettable, to be quite frank. Nurses and midwives are currently have the best pay and conditions across the country because of the partnership and the work under previous governments. And being the most decentralised state in the country, we're the only state with a majority of people outside the capital city, spread across regional Queensland, a lot of rural, remote, small communities, a lot of regional cities. The coverage of our health system there is the most challenging of any state by a country mile. So that is why we need to maintain those nation-leading pay and conditions over the full period of the EB12 period, and it shouldn't be this hard. The new government have, to this point, I believe, failed miserably in terms of understanding the challenges of Queensland and the importance of the nurses and midwives workforce. And I wish you well in terms of the best possible outcome, because we want to see the health system fully populated right across the state, often in very difficult places. And to achieve that, we need a government that understands that. And at this point, the evidence there is a bit thin in terms of them actually understanding that. And, it's not just the nurses and midwives. We see teachers, we see the firefighters, we see even engineers in TMR undergoing challenges in terms of the industrial area. So, one area can be a mistake, 2 is a trend, 3 is a real structural problem about respect for the public sector and our workforce, and the need to keep them and the need to make it attractive to this profession to keep regenerating and bringing that new generation of worker into a really fantastic profession. So I wish you well in that regard. And can I just say that the government's line about cost I find really difficult. One of the first things the government did was backflipped on their commitment to not build new stadiums. In fact, they've committed to building 3 new stadiums, one of which was never even contemplated by anybody. And yet they say they don't have enough money for nurses and midwives, things are tough for teachers. I just don't buy that. I'll be really frank with you, I don't buy that. I don't think it's legitimate in any shape or form, and I hope for the best outcome for EB12 possible for you. The Premier said there would be no health cuts soon after being elected, but sadly that's not what we've seen since the government has come into force. In estimates, we're looking at the budget in detail recently. Last week and this week we had health last Friday. And the opposition asked questions that revealed that the government has only spent $675,000 promoting the free flu jab, and yet they've spent nearly 3 times that promoting themselves and their so-called hospital rescue plan. This is really, the priorities there are so desperately wrong. When we knew there would be a really tough flu season, we knew that we needed to get the jab rates up nice and high, and get that message out early. It was reported as early as February. They knew that, and yet they've spent very little in terms of doing that. And who has paid the price for that? Well, vulnerable people, certainly people with health conditions, people who are over 60, are overrepresented in the numbers of deaths and hospitalisations. But of course, it's our staff as well who pay the price, who are at the coalface, who have to suffer the consequences as well. And we've seen, sadly, 6 hospitals overwhelmed by flu and COVID cases, regrettably, and I think a fair bit of that was avoidable if the government had got on the front foot, backed their health workforce and ensured that people understood the free flu jab was there and it was easily accessible. So we've got to see greater priority from the government. We see also the so-called hospital rescue plan being brought down after they paused construction on hospital expansions, many of them, and new hospitals as one of their first acts in November. And we know that bed block is a major problem in our system. Because of the demand in terms of ramping and population growth, bed block is a major problem, and there's a number of ways of dealing with it. One of the key things is capacity, and the previous government had the largest hospital expansion program in Queensland history. And one of the first acts of the new government was to pause a large part of that program, and that's regrettable. So places like Townsville, Mackay, Redcliffe, Coomera hospitals, construction was paused and hasn't substantially recommenced. And Queensland Cancer Centre, very important initiative, that's been put off indefinitely as well. So these short-sighted decisions that they're not being transparent and honest about will continue to put pressure on the health system when capacity, it's not the only issue, but capacity is a key thing in terms of reducing ramping across Queensland. We've also seen real-time data being brought in. And real-time data has actually increased the pressure on our ED nurses and doctors and staff, because people have unrealistic often expectations based on what they've seen online, and then they come in and then they have very long waits because, of course, clinically there are other people who might have priority. And that we've seen an increase of instances of friction, of violence in emergency departments, and again, it's our staff that suffer. They rushed it in too quickly, they didn't consult properly with the profession, and that's the outcome. And that's something that I would say a responsible government works collegiately and collaboratively with its workforce, and we haven't seen enough of that to happen. The questions in the estimates process, we asked about the increase in the wait lists for elective surgery for those beyond clinically recommended times, and also people waiting for specialist outpatients appointments beyond clinically recommended times. And yet we saw an increase there of 5,820 people waiting on the elective surgery list beyond clinically recommended times in the last 12 months, a 56% increase, and we saw an 11% increase in outpatients waiting beyond clinically recommended times as well. So we're seeing the prioritisation of issues not really focused on some of the things that really matter within the system. We've seen cuts to the workforce attraction incentive scheme that helps us populate a lot of those regional, remote and rural small facilities across Queensland, makes it more difficult to secure staff. We've seen hours cut from the nurse-led clinics, which are preventative measures to get people away from EDs. We've seen the Transport Initiative nurse funding cut, and we also saw pill testing cut as well. The government has said a lot about putting doctors and nurses back in charge, but when you look at the evidence, like pill testing, saves lives, harm minimisation, it's very important that that is a measure that's been around for 20 plus years worldwide, and yet they're refusing to allow it in Queensland. So we need to see better practice in terms of the government working with the workforce. So I also would cover the women and girls strategy, which the previous government brought down to ensure greater equity in our health system. Part of that was IVF being offered free for women who have got complex issues or cancer, so that they can basically have their reproductive rights protected, and that was due to start July 1 this year, and that has not appeared. Despite the fact the Premier said there'd be no health cuts, those women have been left without that. They said they wouldn't cut the women and girls strategy, and yet that's exactly what they've done. And that was revealed by the Labor opposition in estimates only last week. So what we're seeing is a big gap between the claims and the words and the actual actions, and that's regrettable. The government has an opportunity to correct themselves and start working more collaboratively with the workforce, and to start making better decisions in terms of our health. But at the moment, stadiums are getting a higher priority than the health sector, to be quite frank. And that is a government that has got the wrong priorities relatively early in their term. It's 9 months, and we're not seeing encouraging signs in terms of health being prioritised, whether it's the workforce, whether it's capacity, whether it's ensuring the funding's going to where it needs to go. We're not seeing that being delivered. So from a Labor opposition point of view, we will always back the nurses and midwives profession. We've always worked in good faith. Doesn't mean we always agreed, but we worked and had a good relationship, and the last enterprise agreement was a very good one. And I'm just hopeful that with some intervention that we can land in a good spot. But the reality is you've had to fight for it. You shouldn't have had to fight for it that much, but I've been very impressed that the unity you show in the workplace to ensure patients get the best possible care has been the unity you've shown in the workplace with your workmates to advocate for a fair outcome, because we need nurses and midwives moving to Queensland, not moving out of Queensland at a time of global shortage. So thank you for the invitation to be here. I always enjoy meeting with the QNMU in my role as Shadow Health and Mental Health Minister, and I thank you for your work. I hope you have a fantastic conference and they have very good outcomes, and it's been a real pleasure being able to address you today. I thank you for the invitation, and I look forward to continuing to work with the union going forward, and as a fundamental part of our health system here in Queensland. Thank you.